Okay, we're back. Okay. Good afternoon, everyone. I am Marianne Scott, and I will be your facilitator this afternoon. Let me first start by apologizing for being late. It seems I was double booked, so I just rushed over from another class so that I could try and maximize the time that we have left together. So, first matter, just a little housekeeping. I'm not sure how many people have actually registered for this course. I think the last count I heard was 3. So if it is that you're planning to register, it would be good for you to do it very soon, so that, because I will need to start sharing resource materials, so I'll have to get the email addresses for persons that need to access them so that I can share those with you. All right, so this afternoon, we are primarily going to be doing a bit of orientation, discussing what this course is about, what is expected, what you'll be covering in health communication. I'll also be sharing this with you, but we're going to go through it together. Not in great detail, because you'll have time to read it for yourself, but just going through it so that if there are any questions or concerns, anything that we might need to clarify, this is a good time to do it. So I know you haven't received this yet. You should be getting it by the end of today's session. But what we will be doing in the next few weeks is looking at principles of health communication, why or what's the role of health communication in public health. The intention is for our sessions to be more interactive and less, focused on lectures and me doing all the talking and you just listening. I want a participatory approach, so we're going to work through communication issues together, look at real-life applications of theories of health communication, and hopefully you will find it beneficial. All right, so we have some objectives here. So we're going to look at planning and implementing health communication interventions. I mentioned the practice, with this being participatory. We're going to look at some current health communication approaches, doing some analysis of those. And we're going to look at behavior change, because one of the more common things that we try to do with health communication is try to influence some type of behavior change. At some point in all of our lives, we have to change aspects of our behaviors for the purpose of our own health outcomes. And so we're going to look at behavior change and how it interlinks with health communication, and looking at the media as well. So what's the format? Participatory, I said that. And we are also going to look at building some specific skills as it relates to health communication. The contents, we're looking at ethics in health communication. We're looking at the theories, as I mentioned, more specifically, 2 of them listed here. We are possibly going to look at or mention others, but these are the 2 primary ones that we might be focusing on over the next few weeks. And it's the health belief model, the social learning theory, entertainment education model, You know what they say about Caribbean or Jamaican people specifically, we love entertainment, music and dance is in our blood. And so how can this be tapped into for the purpose of health communication and improving health outcomes? We are also going to be looking at planning, right? There's a lot more that goes into health communication behind the scenes that's less visible. So you see the billboards and you hear the ads and the jingles, but how does this fit into a much larger machinery, for lack of a better word? How does this engage with other aspects of health promotion and behavior change to impact our audiences? We're looking at culture. I am hoping to have a guest lecturer come in as well to look more closely at social marketing and public relations. We know a lot about, or we're familiar with commercial marketing. Social marketing has been around for quite some time, but it's still not fully understood. So we will spend some time on social marketing as well. One of the other areas that is especially relevant now is communication in health emergencies. So, you know, hurricane, even in before and after the hurricane, there are critical aspects of health communication that come into play. Yes, in the preparation mode, but in the after effects, we know that there are public health issues that arise, and you're more than likely very familiar with what is happening now with, you know, people hearing about leptospirosis and tetanus and all other types of issues that may occur after natural disasters. There are also other things. Not too long ago, we had COVID, and that was also another health emergency. And what we will also recognize is that risk communication is now having a more dominant role because we're expecting to see a trend towards more health emergencies occurring. And so some of our traditional ways of communicating, where we anticipate that we will have a longer period over which to communicate this and behavior change itself takes a while, we recognize that there are some health issues, some public health events that require more urgent or more immediate responses. So we will spend some time looking at communicating during health emergencies and risk communication. And of course, we recognize the importance of collaboration, networking, and advocacy, especially as it relates to new policies, anything that is new. We have to ensure that we build our partnerships and nurture our relationships, not just necessarily with the media or the media houses, but the gatekeepers and other key players, because health is, well, you know, people talk about health in all policies, and that public health is not just the responsibility of the Ministry of Health. Yes, your ministries and your health authorities lead, but they are not necessarily going to be effective trying to conquer everything on their own. All right, let me pause here to do a temperature check. If there are any questions related to what I have mentioned so far. Okay, that's a no. All right, so you might also be curious about how you'll be evaluated over the course. So most of your grades will come from assignments, both individual and group work. A couple of them might be in class, so during these sessions, you may be asked to complete an assignment, and for that assignment, you will receive a grade. So you have assignments, group individuals, both in class as well as submitted at a later date. And there is a bigger, I want to say a group project. Well, the assignments account for 65% of the overall grade. And then the final group project will be 30%. And because we know that people don't always show up to class, there's a little incentive for participation. So if you attend 80%, at least 80% of the classes, you will receive 5% towards your overall grade. And of course, your final
Is
NCH exam.
face-to-face or online?
No,
This 5%.
not necessarily. No, not necessarily face-to-face. Online is included in that. All right. And final exam, you will have a question that is specific to health communication. So here I have your breakdown of your assignments, the scores or the grades that will be allotted to each one, and some due dates that have been predetermined for some of these assignments. So for example, the first assignment, which is, I don't even know if I should call it assignment, it's an in-class activity. So the first graded activity will be on January 13, and that will be group. That will be a group activity. Even if it's online, it can still be conducted as a group activity, and it will be weighted at 15% of your final grade. All right, so this pretty much is a quick run through of the course outline. So far, I got one question. Do we have any more? I think I see, is there something in the chat? Where's the mouse? The evaluation. All right, so for the purpose, since most of you are online, we have one student in class. And so, trying to get this off my screen. All right, so the evaluation aspect. So 30%, the biggest component, or the component with the highest weighted value, is your social marketing assignment. I think that should be replaced with your final project. It's not your social marketing assignment. My apologies. So the evaluation is based on both in-class activities as well as take-home assignments, or assignments that have a later due date. All right, so I'm going to run through now a little activity for this afternoon. So the objectives of this afternoon's session is to understand and focus. Well, understand the focus and expectations of this course. We're going to look at real world health communication challenges, applying communication thinking to practical scenarios, and engage our peers. Well, I figured it would be hybrid in a learning environment. So group discussions, group work, reflections will be included. And now this is where I am going to ask to hear your voices. So what I would like you to do is just tell me quickly your name, your professional background, and one health communication success or challenge. And what I mean by that is, what I want you to do is think back. Think of a time when communication either helped or hindered a health outcome, whether your own health outcome or something that you have witnessed. How did communication impact that health outcome, for the good or for the bad? I think I heard a good afternoon, but where's the volume? Please go ahead.
Good afternoon, everyone.
Good afternoon.
My name is Cindy Pierre. I am from St. Vincent and the Grenadines, a registered nurse by profession. One of the health communication challenges that we face is misinformation via social media platforms.
I need a little more. Give me an example or a situation that you can think of where that occurred.
So in terms of like natural disasters, there were hurricanes, like in my case, volcanic eruptions. There was a lot of different information coming out about the different stages of the eruption. So we had to make sure that we look and wait on the credible sources like the National Emergency Organization and Dr. Richard in terms of getting the correct information, because a lot of persons was there. We had a layman on the ground that was traveling to the volcano despite warnings not to. So he had his own communication coming out. So there's a split between the population of who they should listen to in terms of getting the right information. And who they trust.
All right, thank you. Thank you for sharing your experience. Who's going next?
Petra Williams-Reno. My professional background is PR and communications. And one health communication success, I would say, has to do with mental health stigma and what has been over time a prevailing culture of silence that has negated people accessing care. In recent times, with campaigns like Speak Up, Speak Now, and more recently, Do Your Share, we are seeing where we are making some headway with that. So yes, the stigma persists, but more and more people are reaching out and accessing care, and the conversation has really opened up around mental health issues.
All right, yes, that is, yeah, the stigmatized health issues definitely require a lot more effort and is usually not very popular in terms of being acceptable or people wanting to associate with it. So that's definitely an area that we want to see more success in. Yeah. All right. Thank you, Petre. Who's coming next?
Good evening. I am Cheryl Smith. I'm a registered nurse. And one health communication success I've seen is the Jamaica Moves, where through the communication from the Ministry of Health, that a lot of us Jamaicans have gotten the message and have started to exercise.
All right. So you think from your assessment, the Jamaica Moves campaign, that the part that is promoting physical activity, you think it has motivated persons to get more active?
Yes,
Has it influenced you?
somewhat.
Somewhat, yes. Behavior change is a process, right? So we know we've all been there. All right. Thank you for that, Cheryl. Who's next?
Good evening. So with
Hello.
the when we had CHICV, there was a lot of information coming to health personnel about what was happening in other places, but it was not disseminated to the wider population. So it was almost as if when CHICV actually happened, it took people by surprise. And so we learned a lesson because I, for one, was overwhelmed with patients. And so when Zika was coming, there was a concerted effort to give people more information about the fact that Zika was in other countries. There's a possibility that it will come here, what the symptoms were going to look like. And so I, for one, deliberately decided to share the information with the health center that I was at, and deliberately made an effort to say to people, okay, here's what. You can do something, we're going to deal with the mosquitoes. And it was something that we kept saying. And so at least for me, for Zika, I was not as overwhelmed as I was in CHICV, and I found that patients knew more. They knew something was coming, they knew how to respond to it, and so on.
So they were better prepared as a result.
Right.
Of the information. And it is also good that we did learn the lesson from CHICV, because it would be much worse if, despite having gone through CHICV and all of the negative feedback from the lack of information, and we still didn't learn. So that is definitely useful in terms of learning to improve. So thank you for that as well. And anybody else?
Good afternoon. Good afternoon, everyone.
Afternoon.
All right. So my name is Simone Doctor. I am a public health inspector. One health communication success, or should I say challenge, was when they had the COVID-19 outbreak. So the information reaching the populace was kind of sketchy at first, because they didn't really know what was happening. And then there was like a ton load of information being provided on the internet, on the radio. It's like persons were overwhelmed with information, so we didn't really know what to believe. So I believe that was a health communication challenge, especially for healthcare workers.
Yes, that was definitely a challenging time for most people. But healthcare workers would have been under tremendous pressure, because people are looking to us to provide the information and the guidance, which in many instances we may not have had or may not have had enough of. I think Cheryl's mic is open, so we're getting some feedback. So if you can, let me see if I can. No, I cannot. Yes, thank you. All right. Anybody left? I see a Vanessa Green.
Hello, good.
Hello.
I'm Vanessa Green. My professional background, I'm a medical officer in St. Thomas Health Department. I was really thinking about a health communication success or challenge. I would say coming down to the patient level, just in terms of health education and giving basic health education talks. I remember I had a patient just saying to the patient, okay, your plate should be this amount of fruits and vegetables, or two to, for example, you say no more than 2 or 3, what should I say, no, like staples in the plate in terms of the portion size. And what I found was that even saying that, I thought I understood what I was saying, and the patient would perceive it that way. But like a patient, they say, for example, they did 2 pieces of yam, 2 pieces of banana, 2 sweet potato, for argument's sake. So the patient ended up having like six pieces of food in the plate. But then in their mind, they were saying that it's 2 or 3 starch. So they weren't looking at the amount of pieces together. They were just saying it's yam, it's banana, it's sweet potato. So they count that as 3. I'm not sure if I'm explaining that right, but I felt like that was a health communication challenge. So they didn't really, yeah. And even just taking the medication, just say take 1 pill twice a day, and they'll take 2 pill once a day, because I didn't really understand that, okay, it's every 12 hours, things like that. So I think that's, for me, a health communication challenge in primary care on that level.
Yeah. And those two, that's very important and common. Some of it has to do with culture, how we interpret things based on our own experiences and the experiences of others, because the person's eaten 3 food, it's 3 different kinds of foods, right? So and explaining portion sizes is definitely not easy. It is challenging. So you will definitely need to spend more time and probably use additional skills of demonstrations and images to at least get that message across. But thank you for that one. That is an everyday challenge that health education and health communication has to grapple with. Is that everyone? I've heard from Vanessa, Cheryl, Nicole, Petrie. Did I hear from Vanessa? Is Vanessa here, or Krishna? All right, maybe they're just logged in previously or stepped away. All right, so initially what we're going to do in today's session, today is not expected to be exhaustive. This session is really just to pique your interest in health communication, to provide a bit of an introduction to health education before we take a deeper dive into the components and all that is required and what you will need to know moving forward. But it's important for us to start off with a definition. And this definition was taken from the World Health
One second, Doc.
Organization.
Is it
Yes,
possible for you
please.
to present
Yes.
in not in presenters mode as I'm seeing it now, but
It's,
I-
oh, well, we're seeing two different things. That's the problem. Because I'm looking at I didn't know it was in presenter mode.
oh,
Because on
maybe
the display in the classroom, it's full screen. All right. It automatically comes as that, you know, so hide presenter view. How is that?
Perfect.
Is that
It
better?
works. Yeah,
Okay.
man.
Well, thank you for that, Head, because we were seeing two different things. I was always seeing it like this. I didn't know you were seeing it as presenter mode. So, see, communication. Thank you. All right. So the C for health, I guess they were trying to be cute with that. It's communication for health. Is the definition offered by World Health Organization in that framework is use of data-driven strategies. So strategies that have been proven to work, not just what we think might work, but strategies that have yielded results. So using these strategies, as well as storytelling and technology to share relevant, accessible, keyword there, because accessibility is important, relevant, accessible, and credible information to influence behaviors, improve health literacy, and empower individuals and communities to make informed decisions for better health outcomes. And this is spanning one-to-one interactions, such as doctor-patient, nurse-patient, health educator-patient, provider to patient, any of those smaller one-to-one interactions, or on a more wider public health settings, such as campaigns, such as town halls, such as school auditorium full of young people, or church congregation. So it goes from individual to group to mass. I think this is a pretty comprehensive definition. Does anybody want to offer another definition or give me some feedback on what you think about this definition? All right, so you're okay with this definition. But I think the parts I want you to pay attention to is the data-driven part. Because as communicators, a lot of times we go with what we know is likely to work based on what we've seen elsewhere, but what is happening locally, right? We need to understand our local epidemic, who is affected. So we will be spending some time looking at audiences and identifying who our target audiences are, because the same thing doesn't work for everyone. So what is the data telling us? Is this an issue that affects mostly men, mostly women, mostly children? Is it affecting a specific part of the country, or urban versus rural? So it's important to look at our data, look at the strategies that work. Are we going to be putting up a billboard when we know that the people that are affected are in a deep rural community and they rarely leave, and that billboard is on the highway? Is that the most effective use? What is our data telling us? The people don't traverse those areas, so you clearly are not putting the information there for them. So looking at the data in various ways to determine what is the most effective, or what is likely to be the most effective strategy in reaching our intended target audiences. And of course, all of this is being done to influence behaviors And by influencing these behaviors, there's usually something that we want to change. There's either a behavior that we want them to start practicing or start adopting, or something we want them to stop doing. And of course, improving health literacy will go a long way in building the efficacy and empowering individuals and communities to make those decisions, because when the community or the individual is involved, it's more likely to be a sustained behavior change or one that is likely to yield the type of outcomes that we're looking for. All right, so why health communication matters? It influences health behaviors. It also shapes policy and advocacy. And it affects trust and credibility. So one person mentioned how was it social media? I think it was in St. Vincent where there were various sources of information. And so people were searching to find the credible source. And usually if the credible source takes too long to respond, which is what may occur in health emergencies, then people run with the first piece of information they get. And you don't want the wrong information out there. So the credible sources have to always be prepared to respond and also maintain that credibility so that the trust of the people can be maintained. The other example about the CHIKV and the Zika, CHIKV in itself, whenever the people can't hear from the credible sources, sometimes they get suspicious. So you're not hearing anything about the CHIKV, but half of the population is limping or can't get out of bed. What is going on? Then that is when you hear all of the conspiracy theories and a lot of false information being spread. And now with everybody having access to the media, social media and otherwise, then the wrong information gets out and spreads even more than the accurate or credible information. And of course, health communication is central to public health outcomes. No matter how free the service is or available it is, if people don't know about it, know the importance of it, or how to use it, then it's irrelevant, right? If people don't know where they can access things or why they need to access it, they won't be accessing it. So you could have all the state-of-the-art equipment and medication and whatever else. Without health communication, uptake is likely to falter. All right, so just to keep us active, like I said, we're gonna spend less time hearing my voice. I would like us just to do a quick activity. Now, it's titled What Went Wrong Here, but it's not necessarily wrong. But what I want you to do, I'm gonna give you some scenarios, and how many of us are really here? I didn't hear from some people. Most, trying to navigate. Participants. Cheryl, Cindy, well, I didn't hear from Krishna, Nicole. All right, I'm gonna probably do 3 groups and give you 3 scenarios, right? And what I want you to do is identify key communication issues, identify the stakeholders and the gatekeepers, and propose one improved communication approach. It will be brief, so you won't need more than 15 minutes. This is just a warm-up activity, introduction to the course. It's not one of the graded ones, so don't worry. But you're just gonna examine some health communication issues and yeah. So the ones I have here, low uptake of vaccination programs for HPV, poor adherence to HIV treatment. And since I'm only doing 3, well, number 3 is very relevant now, so I'll use that one. Number 4 is an ongoing struggle. So community resistance to a health intervention. And in this scenario, I'm using, it says vector controls there, but more specifically, I'm looking at mosquitoes, mosquito breeding, and what's happening with trying to keep our indices down. That's how they call it. Any environmental people here can correct me. So I am going to say that again.
You are correct.
I am wonderful. I have learned. I'm here to learn from you too. This is a two-way street. And with each cohort, with all the varying experts in the batches, I always pick up something. So I'm glad to know I was correct. All right, so let me see who I have here. I am going to share in the chat what the scenarios are. Okay, what am I doing? Oops, what did I do? All right, core scenarios. Not that one. Got too many things. This one. Oh, I forget I'm sharing everything, so I just need to put it up. So here they are. So low uptake of HPV vaccine. So despite the availability of HPV vaccine for free, through the public health system, vaccination coverage among adolescents 10 to 14 remains low. And by low, I mean below what the target is that has been set, and not just marginally low, significantly low, based on the last set of data I saw. So it remains low in several communities. Health authorities have reported that, where's my cursor? Many parents are hesitant or refuse consent. Some adolescents have limited understanding of HPV and it's linked to cancer, and misinformation circulates on social media suggesting the vaccine encourages early sexual activity. Healthcare providers report limited time and confidence to discuss the vaccine with parents, and school-based vaccination programs face logistical and communication challenges. And as a result of all of this, HPV-related cancers remain a significant health concern. One scenario, one group will be assigned that. Second scenario is poor adherence to HIV treatment, specifically ART, antiretroviral therapy. So public health clinics, guys, these are not necessarily 100% facts, right? These are scenarios we're working on. So public health clinics report suboptimal adherence to antiretroviral therapy among adults living with HIV. Despite it being free, remember what we spoke about, making it free does not guarantee uptake, free access to treatment, and routine follow-up services. So clinic data and staff report that some clients miss appointments or collect medication irregularly. There are complaints about side effects that are not communicated to providers. Stigma and fear of disclosure is also strong in the community. Clients working in informal employment, so those day workers, informal, they don't necessarily get time off or vacation or sick leave. So those clients find it difficult to attend clinic because missing a day means missing a day's wage. They have issues with the operating hours. Communication between healthcare providers and clients is often brief, directive, and biomedical, with limited counseling or follow-up. I'm not saying this is what happens. This is just a scenario. So as a result, there is increased risk of treatment failure, drug resistance, and onward transmission. So the second group will work on that. And the third is the mosquito control. So following the rise in dengue cases, the Ministry of Health has launched or is intensifying mosquito control programs in several communities. The interventions include fogging, larviciding, is that a real word? Household inspections, and source reduction campaigns. However, the response has been mixed. Some residents refuse access to their homes or yards. Others express fear about chemical exposure, especially for children and pregnant women and their pets. Rumors circulate on social media that fogging causes illness or that it is ineffective. And community members feel excluded from decision-making and report poor communication from authorities. Trust in government institutions is low due to past experiences, and as a result, mosquito breeding sites persist and disease transmission continues. So, I am going to do, don't include that. All right, do you want to choose your rooms? Let me be nice for the first day. Is there a particular interest in choosing your room? All right, no.
HPV.
Who said HPV? Vanessa?
Esther.
All right.
I like H.
Vanessa and Cindy
Yes, please.
for HPV. Anybody else?
Vector control for me, please.
Vanessa and Cindy for that one. And vector control is for, say the name
For
again?
Simone. Simone, doctor?
Simone. Who is joining Simone?
I'll join Simone. Petre.
Petre? Okay. And what was the last one? HIV. I know I'm gonna pick on this person.
Nicole.
Who's
Hoping you
joining?
wouldn't.
Nicole Webma.
I was hoping you wouldn't.
I know you were hoping, that's why I acted quick before you could say anything. And Cheryl? Cheryl, are you here?
Yes, I am.
Okay, because it's Krishna here. I didn't hear before if she was here. So it looks like it's 2 per group because I don't.
It's on. She had logged on. Hot Thomas.
Okay.
You can put her in the vector control group.
Krishna? Okay, I will. Okay, so I didn't even tell you what you're gonna do. Oh my. Hold on. Hold on. It's a easy assignment. So what I want you to do is come back and tell me identify 3 key communication issues and 3 stakeholders or gatekeepers that you need to engage as a priority. And I want you to recommend 1 communication strategy to try and address the issues or one of the issues. Is that clear? Should I put it on the paper? So I'm
not sure if it's
let me
on my
email-
end, but for me, there's this blue box.
Yeah,
that's
that is me trying
kinda
to do the breakout
obscuring.
rooms.
Oh, okay,
So what
okay,
I'm
got
gonna
you.
do is open the rooms now, and then I'm gonna put that Word document that gives you the scenario, and you have just about 15 minutes to discuss it and just respond to those questions, right? So the things you're gonna, mosquito. You're going to identify 3 key communication issues. Just jot it down, please, because forgot to put them on the actual paper. 3 key communication issues, 3 stakeholders or gatekeepers that must be engaged, and 1 recommended communication strategy. All right, so I'm gonna put you in the rooms now. I think I'm making this harder for myself. No, I'll add the document after. All right, folks, so 15 minutes. As soon as you get your file with the scenario. First, we're all back, right?
Yes, we are.
Wonderful. All right, so let us hear what you made of the little practice activity.
All right. So for my scenario,
Mhm.
I was about to actually ask not to get it, but we press on. The 3 communication issues that we identified were that 1, the clients expressed that they didn't have enough time with the persons and that the communication was very prescriptive and it was biomedical. So it didn't focus so much on the patient themselves and helping the patient to come up with a solution or strategies for their own problems, but rather telling them what to do. The patients, they highlighted stigma and discrimination as an issue, and also that there was one other thing that I forgot. The
There's also
persons who were saying that they had a difficulty with making the clinic because of the work times. And we identified that as a communication barrier because we know that there are several options in terms of different sites that they can go. There are sites that offer Saturday and evening. And then there's also the option of going the NGO route or to Health Connect is helter skelter for now, but there are many options that the patient should be aware of that they possibly are not aware of. In terms of the stakeholders, the patients have to be center. And I thought in pairing the patients, we also pair the their own patient associations like JN Plus would be key as a stakeholder. I group service providers as one. So we know the Ministry of Health or regional health authorities or parish level. And then, of course, you have the NGOs that provide service. And then on the other hand, I included the Ministry of Education and Youth because youth is included. And we know youth are they're among the drivers for the HIV epidemic currently. And also education, because if we can capture or provide information early, then it will help us in terms of how we are better able to give accurate information that will impact decision making. And then the last strategy is, the last thing that we looked at was strategy. And then the strategy would be to well, there are multiple things, but I'm going to pick one. One of them is, I know that we've done some of it, but to ensure that all the providers have been trained in motivational interviewing and those strategies that are patient-centered, that helps patients to make better decisions or come up with their own solutions while the care provider guides the discussion. And that's it for me.
All right. Thank you for.
Morgan, after all, I'm just a girl.
Vanessa,
Let's say, all right.
somebody's mic is open.
Where's Vanessa's?
Hello, I'm sorry.
That's fine.
That's fine. All right. So for,
I guess I can go
for
next.
no, one little second, please.
Oh, sorry.
For the treatment group. So you mentioned the type of, missed appointments and the collecting medication irregularly. What do you think can be done from a health communication perspective to address that specific issue? Nicole.
Excuse me?
I was trying to zoom in on more specifically, some of your issues like your missed appointments and the ones that are collecting their medication irregularly. How do you think health communication could address that part of it?
Yes,
Any ideas?
In terms of misappointments, it's really how we ensure that the patients can communicate with the team. I found that was an issue. So we had actually made a concerted effort to give patients a card. Comprehensive didn't have a landline for probably about 5 years. So the patients could call the clinic. So if they needed something. So now that we have a landline, we've actually been advertising. We give the patients a little card with the number, and we have also tried to ensure that whoever sees the patient gives the patient a contact number. So somebody is responsible for ensuring that the patient has a contact number that they can reach out to somebody to say, I'm having an issue with coming in, and we can reschedule and so on. Because we find that is part of the problem, that the patients don't know how to reach us sometimes.
Okay. One of the more useful things that we can tap into in terms of health communication for situations like these is, because we know this isn't necessarily a unique or an individual issue, we can perhaps review and see how common or how often this happens and perhaps put up any kind of, I don't want to say posters because those are all kind of out of style. Nobody don't really put a poster anymore. But place the information in a common area to say, okay, if you missed the appointment, this is what you can do. Or information on the importance of not missing your appointments. Why it is important to keep your appointments. Ways that you can remind yourself about your appointments, putting it in your calendar if you're tech savvy and have a phone. But what we want to do is reduce the burden on the individuals, the individual healthcare worker that is, or provider, to have to keep reminding each individual. So I know we have automated systems. When they do work, they're useful, right? But it's almost, how can we use health communication to set a bigger or wider net?
So one of the things that we do is when the patients come, we usually, somebody assists them with how to create reminders in the phone.
Yes.
So we usually assist them with that so that they know how to. They use the reminders for taking their medication, and they also use the reminder to say when is their next appointment.
Yes. And so you have different levels of health communication. So those are more on the micro or the individual or the site level health communication. But I know the ministry and the policymakers, the decision makers also have a role. So like the HIV unit might recognize that this is impacting treatment outcomes and decide to make a broader appeal, a more public or a wider appeal to say, look, people, well, you know, they do a lot of campaigns. There could be one about keeping your appointment, why you should keep it, protect your health. This is how you're going to stay healthy. It's important, not just because you feel okay, doesn't mean that you're okay going for your checkup, that kind of thing. So it can be at different levels. It could also, how does culture play a role? How important is your medical visit? And just a reminder and encouragement. But yes, and similarly for this stigma, I think this is also one of the areas where you can have a much wider reach in terms of addressing stigma for the family members, the friends, and whomever else, so that people can feel.
So they really have a one place to sleep, but you know that
which is why I said that there was so much to decide on picking one, because as I was discussing with Cheryl, I was saying to her that there's a patient that came. The first thing that struck me was that he was not waiting in the waiting area. He was at the end of the corridor, down the corner by himself, but he was very agitated, and the man was cussing. And he wasn't, it wasn't like he was directing it to somebody in particular. He was just, and I took the doctor and I said, no man, something wrong with this man. This not normal. And when I was talking to him, we talk about stigma and discrimination from the outside. But you see that self-stigma is a total different thing.
Yes.
And this man was experiencing self-stigma. Man literally went home, took one set of cup, plate, everything, and put in a space and told his daughter not to touch it.
For himself.
That it was his and nobody else is not to touch it. He stopped hugging his child. He stopped everything that he used to do, and he's the only parent she has. So all the things that he would do for her, he now stopped doing, because in his mind, he's protecting her. And so we really need to get the information out there, because I'm like, at this point, people should know that you can't get HIV from a cup or a plate. So
Yeah,
for this man to go home and do this, it means that we're not getting the information out
it's
there
not
as we're
reaching
supposed.
all the people who need it. And also I am going to jump onto one of your stakeholders that could help you in that regard. You mentioned JN Plus as one of your stakeholders, your NGOs you mentioned as well, because of course, your partners are also critical in this. All right, well, thank you very much for sharing your experience with us. And I'm going to ask for the next volunteer to just jump in right now. Which one is going to come next? Is
We
it
looked at vector control.
your vector or your vaccine?
Vector. Vanessa is vaccine.
Okay, all right.
Hello? I
Go
got
ahead with
I
the
got
vector.
kicked out. My internet was poor. Is it our turn?
No, not yet. Vector control is gonna go.
Okay, sure. All right.
All right, so the scenario is on the screen. For us, the gatekeepers / stakeholders are community leaders, vector control personnel, and that would extend to our public health inspectors, as well as the Ministry of Health / regional health authorities. And the MOH / RHAs, because they handle the resource management and flow, including personnel. So the folks who are going to be actually on the ground doing the work, those people are augmented or determined by the Ministry of Health, as well as they talk about the larviciding and stuff, all of the chemicals and the various things that we need that would come through MOH. The community leaders, because there are some access issues and so on. So we need to find somebody who is going to give us a window, a door into the community, so we'll have an opportunity to engage the people on the ground. And then, of course, our vector control workers, when the people lock the door, is them who have to deal with the issues, right? They are the ones who have to interface with the folks head on a day-to-day basis. And so we think, again, that those three sets of folks are the ones we want to be focused on. In terms of our set of issues, the three communication issues, as we see it, are, am I looking at the right thing? Sorry. One, the fear that residents are expressing about chemical exposure, especially for their kids, pregnant women, and pets. We also want to look at that issue of the rumors circulating on social media that fogging causes illness or is ineffective. And thirdly, that community members feel excluded from decision-making and report poor communication from the authorities. And then in terms of what we're going to do about it, similar to Nicole,
No,
there are
but
any...
Petrie, I'm going to interrupt you. I want you to tell me what the issue is that might be causing those problems. What do you think is causing, why would people refuse them access? Is there any communication issue that you think might be causing people to refuse them? Is it only a communication? Is it a little cultural? Is it a little...
So yeah, it could be any number of things. It really could be any number of things, right? So fear becomes miscommunication. It could be an issue of infodemic, where there are multiplicity of information sources coming at folks and they're not health literate enough to kind of decipher and come to a sort of reasoned conclusion about the thing, you know, how to distill that comes. So it could be any number of things. And this is why the intervention that we chose in terms of that one proposed communication approach is this. And you started out our lecture this evening with it, this idea of the value of data-driven communication. So I can sit here and speculate about why there may be fears. Maybe they're not getting the information where they're supposed to get it from. Maybe it's a health literacy issue. Maybe them and it's a cultural issue. Maybe them and the people who come to the community don't get on. It could be anything. And so what we'd want to do is to pull back a little bit and engage those gatekeepers, the community leaders, for the access to the folks in communities so that we can have a conversation with the people and begin to distill Well, you talk about the fear of the chemical. What exactly is the nature of the fear that you have? What are some of the rumors that are circulating on social media? What are you hearing? What is it that makes you uncomfortable? Right? How do you feel? I mean, this business of being excluded, how would you want to be included? Right? Because sometimes we assume inclusion mean a certain thing, but when you talk to the people, it's a different story. And so the idea is to distill all of that by engaging in some of that data collection piece. And then based on what comes out of that engagement, we would tailor the communication response. And so that is our approach.
Yes. And I would also put to you that that engagement is a communication approach in terms of maybe debunking some myths, the rumors that are circulating. That is a ripe opportunity for you to address them head on and to provide the facts to try and address some of those rumors and allay some of the fears. So it would serve the dual process of, and then of course, we know communication goes two ways. So you are hearing from them and you are also providing them with the credible information, the facts that they will need in order to consider taking on your recommendations.
Exactly.
All right.
Yes.
Good.
Yes.
Okay. All right. Thank you. I'm going to go to the HPV group now.
Okay, Cindy, you're on, right? So our all right, so our group scenario was a low uptake of the HPV vaccine despite its availability among the adolescent population. All right, so identify three communicate. 1 second. Right, so the three communication issues. So we said the health literacy among the adolescents about HPV, the virus itself, and its link to cervical cancer and other cancers. That was a communication issue. The miscommunication on social media that the HPV vaccination encourages early sexual activity. And the fact that healthcare workers report that there's a time constraint and a confidence issue to discuss the vaccine with parents. There were other communication issues, but these were the main three we took out. In terms of
Vanessa, just like with Petrie, I want you to tell me. So these are the issues that are stated here, but I wanted you to tell me what are some of the possible communication gaps that would have caused. So for example, you said low literacy, low health literacy mentioned, right? So is it possible that health literacy is low because there wasn't adequate promotion?
Okay. I get what you're
or
saying. I actually
engagement?
mentioned more about it when I was speaking about the strategies for each. So the
Okay, so all right, let me allow you to finish. Yes, go ahead. Sorry.
Sure. All right, I'll just jump on that and then talk about the key stakeholders last then. All right, so to tackle the health literacy among the adolescents, we were saying there is a lack of and there's a need for more health promotion activities, which include health education and perhaps like demonstration to show them how the vaccine how the virus actually affects the cervix to cause cervical cancer and other areas of the body for other cancers. Pardon me? And we could do these things at like the PTA meeting so that we can engage the adolescents and their parents. We could do it at adolescent clinics as well. which is a clinic case that is specific for them, so that we will have more one-on-one communication with them. Not really, even though in reality they are still mixed with the regular population, but in some parishes they actually try to facilitate the adolescents on a different day, some on the weekends, so it's just them, as well as through the HFLE classes in the schools, right? So basically what we'll be talking about is cancer, how the angle we'll take it from is that we're looking at cancer elimination. So it's a preventable cancer, and it's the only cancer right now that a vaccine is actually available for, and it's free. And during this health promotion sessions, we'll facilitate Q&A sessions to address any myths or concerns that they have with vaccination. In terms of the misinformation on the social media now, so we know that there's a lot of information out there, and if the Ministry of Health and Wellness, as well as the Ministry of Education and Youth, if they don't steer the information, things can be misconstrued. So we were saying that a strategy could be to do public health campaigns on all accessible social media and print media platforms with culturally acceptable in a culturally acceptable way. So using like our Jamaican folklore skits, TikTok videos, short reels, the role play, maybe with adolescents and their parents, and healthcare workers, catchy songs, hashtags, stuff like that, to give accurate, concise, and clear information and debunking myths about giving facts, as well as debunking myths about cervical cancer, about the HPV vaccine and the fact that it encourages early sexual activity. With the healthcare workers now talking about their confidence and their time constraints, we're saying we need more capacity building, training for healthcare workers on HPV vaccination, so that they are aware of the schedule, the active ingredient, whether it's a live or attenuated form of the virus, common side effects. So just to equip them with the knowledge and the information, so that when they are being asked by the parents and other persons, they can have accurate information that will boost their confidence. And in terms of the time constraint now, at the adolescent clinics, like I said, when it's a clinic geared toward adolescents, they may have a little bit more time to speak freely on it, or we could the videos could be playing in the health centers or in the waiting areas, so that they can get more information, based on the repetitiveness of it while they're waiting. They can hear clearly, the skits are being shown, so they get information in that way, if the doctor can't really spend a lot of time giving them every single information. If they have particular questions now, when they come to the doctor for that doctor patient interview, they could get more information. And even on the school buses, for example, now we have the rural school buses, if they could have like, a little TV in there, it could be playing some of this health information on their ride to school. So the key stakeholders, definitely we need to get the parents and the adolescents on board, the school staff, so that includes the school nurses, the teachers, the HFLE teachers, the health and family life teachers, the principals, the healthcare workers, and the community at large. But certainly the parents, adolescents, and the school staff, though, those will be the main stakeholders. I hope I answered it, but if not, I can.
Vanessa?
Then I can. Hello?
Vanessa?
Hi.
You gave me a whole communication plan.
Oh, Lord. Sorry.
Which is not a bad thing.
That's Vanessa.
I'm not saying it's a bad thing. I'm saying that, yes, you did do what you were supposed to do, plus a whole heap more. So yes, I think you were very comprehensive. The others would not be, because I didn't ask them for this level of detail. So you would have all done what you were supposed to do. That was not a question at all. I'm just curious, though. I'm just reflecting on all of these scenarios. And what I recognize is one of the drivers of behaviors or the determinants of behavior is our culture. And I'm not sure if you notice how strongly they featured in these scenarios. So this vaccine one, we have a culture of guarding and gatekeeping the sexuality of our adolescents, especially our girls. So, that's one of the red flags that came up first when people heard about the vaccine, and it was possibly one of the blockers or the barriers to the slow uptake or the unwillingness. Also with the mosquitoes and the vector control efforts, we can be very territorial and we don't want anybody to come in our place, come into our yard. Who are these strange people that are uninvited? We're very protective of our spaces and we don't just open it up to anybody. So it's how do we help people to trust us? I think it's the building of the trust that I'm trying to get at. In the HIV scenario, we know the self-stigma is largely linked to how we think people perceive us. And that also led the individual that you are giving the example of to stigmatize themselves. You often hear of people giving you the cup and the plate, but not you deciding that you're going to ostracize your own self. So a lot of the challenges that we're likely to face in health communication is related to our culture, our norms, our values, and those are tough to break into. So we're gonna see this recurring as we progress through the course. All right, so health behavior change. Somebody wants to say something? I thought I heard a mic open. We're going to talk about the theories and how we can utilize some of the health communication theories that we're going to learn about, or that we're going to refamiliarize ourselves with, because many of us or some of us may be familiar with some already. But how can these communication theories help us to tackle some of these barriers and the pushback that is likely to occur from some of the interventions, largely geared towards how people feel and the attitudes towards the behaviors that we're trying to encourage or the behaviors we're trying to change. Looking at integrated marketing, that's where your social marketing comes in, and other different types of strategies to reach the target audiences and the stakeholders. You listed some of them, all of them aptly described or were very relevant to the scenarios that you were given, but we need to look more closely at how we can make these relationships and these partnerships more effective, more meaningful, more impactful, and how we can keep the media on our side. Because remember, the media is there to be objective, and if you are not engaging or appear to be transparent, then the media may report in a way that is less than favorable to your cause or to the mission that you are trying to accomplish. So that was these activities was just to give you a little whet your appetite, if I can say that, a little bit for what we're going to be trying to contend with over the next few weeks. So just reminding you, we're going to have collaborative activities, individual writing, material development. We're looking at social marketing. And of course, your class participation is always important. Active participation, whether you're online or you're here. I see that the preference is to be online. Is that the consensus? Let me just hear from now so I can not show up here and be by myself in the room again. Is that what we're doing?
Miss,
Uh-huh.
right now I'm here confused because I was like, I didn't even realize it was an elective course. So I was like,
Oh.
I don't choose this elective, but I'm here actively participating. So
Oh.
right. So I think that kind of caught some of us off guard. So I'm not sure how many persons actually registered for health communication, but I think about
Only
2 of us so
3.
far on
I
here,
think
not
I'm
really
told 3.
registered.
Okay. I'm told 3. I don't know if there are more to come, but that's what I was told. But
Okay,
for
so maybe
now,
most of them will be online.
yeah. All right. So let us, in closing, it's that time. What time is it? All right. Yes, I'm tired, and I'm sure you are too, because all of you are, or most of you are juggling work and study. What are you expecting from this course? Give me one expectation that you have so I can start working on it from now.
I'm expecting to learn how to use communication to break through barriers. In terms of promoting healthcare.
Okay. So Cindy wants to break through some of those barriers that are holding back her programs or holding back programs in St. Vincent. All right. Anybody else wants to share what their expectation is of this course?
How to make the case for communication. I mean, I think in a crisis, everybody is all about comms, but in the normal way of being, it's not necessarily given the kind of priority that it needs. And so I would hope that, you know, you would sort of help us to make the case for communications.
Yeah,
And see how
you're
we are
only important
mobilizing
when
money.
it's urgent.
Right? Exactly.
Communication is only important in a crisis. Oh boy. All right, thank you, Peter. Anybody else?
Improve our
Uh-huh.
well, one gain insights into different strategies for communication, but also to improve the effectiveness of my own communication.
So you want to talk, looking at the strategies and effectiveness for you to improve in your communication, in your health communication. All right. Good. Okay, any questions? This is it, you know, guys. We're closing off now. Any questions you have? All right. Well, this is it. This is just what we're gonna do moving forward. We're looking at foundations of health communication, role in health promotion, and we have to talk about some ethical responsibilities. So, this is where we conclude for today's session, and we gather again on Friday. So if there are no other questions or comments, I want to thank you for your participation and bid you a good afternoon.
All right. Thank you. Take care.
Thank you, Miss. Take care. Get home
Bye.
safe travels.
The police needs to win.
Take care, everyone.